Hello and welcome back to my channel, where we discuss various topics related to health and well-being. In today's video, we're going to talk about an important aspect of reproductive health, birth control methods, and how to use them effectively. So, let's dive right in. Choosing the right birth control method is a personal decision that depends on your individual needs and preferences. It's crucial to have a comprehensive understanding of the available options to make an informed choice. 1. Short-acting hormonal methods. Short-acting hormonal methods are contraceptive methods that utilize hormones to prevent pregnancy. These methods typically involve the use of synthetic hormones, such as estrogen and progestin, which mimic the hormones naturally produced in a woman's body. Short-acting hormonal methods are reversible, meaning their effects are temporary and fertility can return shortly after discontinuing their use. Here are a few examples of short-acting hormonal methods. Combined oral contraceptives, COCs. COCs are commonly known as birth control pills. They contain a combination of estrogen and progestin and are taken orally on a daily basis. These pills work by preventing ovulation, thickening cervical mucus to hinder sperm movement, and thinning the lining of the uterus. Progestin-only pills, POPs. Also known as mini pills, POPs contain only progestin and are taken daily. Similar to COCs, they work by thickening cervical mucus and thinning the uterine lining, but they do not consistently prevent ovulation. Contraceptive patch. The contraceptive patch is a small, thin patch that is applied to the skin and releases estrogen and progestin hormones into the body. It is worn for 1 week at a time and replaced weekly for 3 weeks, followed by one patch-free week. Injection. The hormonal injection, commonly known as the Depo-Provera shot, is administered by a healthcare provider every 3 months. It contains a progestin hormone and works by preventing ovulation and thinning the uterine lining. These short-acting hormonal methods are highly effective when used correctly and consistently. It's important to consult with a healthcare professional to determine the most suitable method based on individual health needs and preferences. 2. Long-acting hormonal methods. Long-acting hormonal methods are contraceptive methods that provide an extended duration of protection against pregnancy with a single administration. These methods utilize synthetic hormones, such as progestin, to prevent ovulation, thicken cervical mucus, and thin the uterine lining. Unlike short-acting methods, long-acting hormonal methods do not require daily or frequent administration. Here are a few examples of long-acting hormonal methods. Implant. The contraceptive implant, such as Nexplanon, is a small, flexible rod that is inserted under the skin of the upper arm by a healthcare provider. It releases a progestin hormone and can provide protection against pregnancy for up to 3 years. Injectable. The hormonal injection, commonly known as the Depo-Provera shot, is administered by a healthcare provider every 3 months. It contains a progestin hormone and offers an extended duration of protection against pregnancy. These long-acting hormonal methods are highly effective at preventing pregnancy and offer the convenience of not requiring daily or frequent administration. They provide reliable contraception for an extended period, reducing the chances of user error. It's important to consult with a healthcare professional to discuss the suitability of these methods based on individual health needs and preferences. 3. Sterilization. Sterilization is a permanent form of contraception that involves a surgical or non-surgical procedure to prevent pregnancy by blocking or interrupting the reproductive pathways. It is considered a highly effective and permanent method for individuals who do not wish to have any more children. Sterilization procedures are available for both males and females. Let's discuss the 2 main types. Female sterilization, tubal ligation. Tubal ligation is a surgical procedure for women that involves closing or blocking the fallopian tubes, which are the pathways that allow the egg to travel from the ovaries to the uterus. This procedure can be performed through different methods, such as cutting and tying the fallopian tubes, sealing them with clips or rings, or blocking them with implants. Tubal ligation is typically done under general anesthesia or local anesthesia. Male sterilization, vasectomy. Vasectomy is a surgical procedure for men that involves cutting or sealing the vas deferens, the tubes that carry sperm from the testicles to the urethra. This procedure prevents sperm from mixing with semen, thus rendering the man sterile. Vasectomy is usually performed under local anesthesia, and it is a relatively simple and quick procedure. Both female sterilization and vasectomy are considered permanent methods of contraception, and their success rates in preventing pregnancy are very high. However, it's important to note that while these procedures are intended to be permanent, they can sometimes be reversible through additional surgical procedures. Reversal success rates can vary, and it's crucial for individuals considering sterilization to carefully consider their decision, as it is generally intended to be a permanent choice. It's essential to discuss the benefits, risks, and potential complications of sterilization procedures with a healthcare provider. They can provide guidance and help individuals make informed decisions based on their unique circumstances and reproductive goals. 4. Fertility awareness methods. Fertility awareness methods, FAMs, also known as natural family planning or natural contraception, are approaches that involve tracking and interpreting various fertility signs to determine the fertile and non-fertile phases of a woman's menstrual cycle. FAMs are based on the understanding that a woman is most fertile during the days leading up to and including ovulation when an egg is released from the ovary. There are several types of fertility awareness methods, and they generally rely on one or more of the following indicators. Basal body temperature, BBT. This method involves taking your temperature every morning before getting out of bed. Basal body temperature tends to rise slightly after ovulation due to the release of progesterone, indicating that ovulation has occurred. Cervical mucus method. This method involves observing changes in the consistency and appearance of cervical mucus throughout the menstrual cycle. As ovulation approaches, cervical mucus becomes clearer, slippery, and more stretchable, resembling raw egg whites. This indicates the fertile phase. Calendar method. The calendar method involves tracking the length of menstrual cycles over time to estimate the fertile window. This method assumes that ovulation occurs approximately 14 days before the start of the next menstrual period. However, it may not be accurate for individuals with irregular menstrual cycles. SYMPTOTHERMAL method. The SYMPTOTHERMAL method combines the tracking of basal body temperature, cervical mucus changes, and other secondary fertility signs, such as changes in the cervix or pelvic discomfort, to identify fertile and non-fertile phases of the menstrual cycle. It is important to note that fertility awareness methods require consistent and accurate tracking of fertility signs, as well as a good understanding of the method's principles and limitations. Fertility awareness methods are most effective when used by individuals who are highly motivated, have regular menstrual cycles, and receive proper training and guidance from a qualified instructor or healthcare professional. If you are considering fertility awareness methods, it is advisable to consult with a healthcare professional or certified instructor who can provide comprehensive information, guidance, and support to ensure proper and effective use of these methods. It's also important to use birth control methods consistently and correctly to maximize their effectiveness. Reading and following the instructions provided with each method, attending regular checkups, and seeking guidance from healthcare professionals are essential steps in using birth control methods effectively. That wraps up today's discussion on birth control methods and how to use them. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more informative content. Remember, taking control of your reproductive health is empowering, and making informed decisions about birth control is an important part of that. Take care, thanks for watching.